to all the attendees in webinar 219 of today. This is our webinar 219, almost 4 years of continuous learning since we started this cycle of webinars in 2020. We're happy to present this webinar, Inclusion in the Workplace, Occupational Safety and Health. In the Universal Declaration of Human Rights, we can read that everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and to protection against unemployment. We want to highlight a very important concept, positive peace, which is defined as the attitudes, the institutions, and the culture that maintains peaceful societies that are essential for the people's well-being. Decent work is essential for building peace. Let's keep in mind that children and adolescents are the present and should not be forced to work. One of the Sustainable Development Goals says by 2025 end child labor in all its forms. This is why from Orozcono we promote health and rights as a bridge to peace. These reflections are included in the monthly edition of Noti Salud Andina's newsletter, which we invite you to read and which can be found on the website of the Andean Health Organization, Organismo Andino de Salud. We invite you to leave your name, organization, and country in the chat box of Facebook Live or YouTube Live. In the same space, you can leave your questions or send them via email to webinaroroscano@gmail.com. In this webinar, we will follow the usual dynamics. We will begin with the institutional greeting, followed by the presentations of our speakers, and then we will move on to questions and answers. To access the certificate of attendance, as usual, in any of the Facebook Live or YouTube Live chats, you will find a link where you will have to fill out a short survey and leave your data as email. Please check that your email address is correctly typed. The certificate will be sent to your email address in the next few days. To begin this important day, I will give the floor to Dr. Maria del Carmen Calle Davila, Executive Secretary of the Andean Health Organization, who will give the institutional welcoming remarks and greetings. Go ahead, Dr. Calle. Thank you so much, Berta. Good morning, good afternoon, good evening. Depending on your location, as you know, the Andean Health Organization, Hipólito Unanue Agreement, Orozcono was established by decision of the Ministers of Health of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela in December 1971. Since May 2020, we have been holding weekly webinars to promote continuous and constant learning. Welcome to webinar number 219 to commemorate the World Day for Safety and Health at Work, April the 28th, and the International Workers' Day, May the 1st. First of all, I would like to emphasize that the Universal Declaration of Human Rights of 1948 states in Article 23, everyone has the right to work to just and favorable conditions of work and to protection against unemployment, ensuring for himself and his family an existence worthy of human dignity. Everyone without discrimination has the right to equal pay for equal work. Everyone who works has the right to just and favorable remuneration, ensuring for himself and his family an existence worthy of human dignity and supplemented, if necessary, by other means of social protection. Because of the urgent need of vindicating this right, today we present the social panorama of Latin America and the Caribbean report, prepared by ECLAC, which concludes that labor inclusion is key to combating poverty, reducing informality and inequality, and advancing towards sustainable development. It is a priority to guarantee access to quality jobs, labor income above the minimum wage, and of course, access to social protection. To commemorate the World Day for Safety and Health at Work, we will present the main ideas of the report, Ensuring Occupational Safety and Health in a Changing Climate, prepared by the International Labor Organization. Workers face occupational hazards exacerbated by changing weather patterns such as excessive heat, extreme weather events, vector-borne diseases, etc. Many health problems are related to climate change. Promoting, respecting, and realizing the right to a safe and healthy working environment at work also involves addressing the harmful effects of climate change. I would like to warmly welcome our distinguished speakers, Maria Luisa Mariño and Schneider Wataki, and our participants to commemorate together an International Day for the Right to Decent Work and a World Day for Safety and Health at Work, and 365 days for us to strive for their implementation. Welcome all. Thank you very much, dear Mari Carmen. Now we will listen to my own greetings. My name is Berta Luz Pineda Restrepo, Sociologist, Coordinator of Climate Change and Inequalities at the Andean Health Organization. And today I will be in charge of moderating this webinar with great pleasure. We would like to extend a warm welcome to Schneider Wataki Cervera. He is a national coordinator of the Occupational Health and Safety Project of the International Labor Organization and focal point for occupational health and safety for the Andean countries. Mr. Wataki Cervera is an industrial engineer and holds a master's degree in quality and integrated management. He's also an internal auditor, a lead auditor, and has been a consultant in the implementation of integrated management systems and audit execution. He led the process of implementation of public policy of the occupational safety and health management system from the Ministry of Labor of Colombia. He is the author of the book Occupational Safety and Health Management, a practical manual or handbook for the implementation of minimum standards. He has participated as a national and international lecturer and is a teacher in occupational safety and health. Go ahead, dear Schneider. Good morning, everybody. First of all, I would like to thank you for this very important invitation, for giving me the opportunity to continue promoting these environments of safe and healthy workplaces. Today, we're going to talk about climate change and the impact on workers' health. So I will share my screen. 1 second, please. Please, can you confirm that you can see my screen? Yes, we can. Okay, so thank you so much for being here today. I'm very happy to be here In this webinar today, I will focus on the World Day of Occupational Safety and Health in climate change. This day, April the 28th, many institutions are celebrating this day because of the importance of protecting our workers. So I would like to begin by saying that in the report you will find how climate change is already generating serious impacts on the health of the planet and workers, and how these aspects have been prioritized in this report in six factors, which highlight the importance of one of the actors that are mostly exposed, the workers, and therefore they are exposed to longer periods, more intense periods, where it will be necessary to start looking at how to prevent these diseases and deaths that have an employment source related to climate change. Let's consider that this will be seen in the report. Some diseases such as cancer, cardiovascular diseases, respiratory diseases, muscle disease, and other conditions that seem to be unrelated, but which can be related to the impact of climate change. So we will begin talking about these effects of climate change. First of all, we would like to point out that there are some workers that are particularly exposed, those who work outdoors. How are these workers affected? Those from the agricultural sector, transportation sector. I would like to mention that in Colombia, we have been working a lot with the rural sector with different populations, and we were seeing how in one of the sectors, the fishing sector, workers do something known as la faena. They go out fishing, artisanal fishing, from 3 to 15 days offshore. And we saw how these workers had to withstand storms, how they were exposed to the sun all day long. So, all of these workers that are out there, such as agricultural construction workers or transport workers, they are exposed all day long and they are subject to some conditions and they have higher risks. We have all of these workers that are in hot environments. So there are some other ways in which these ultraviolet rays affect them. Probably they are not working outdoors, but they are also impacted. We have all those workers that are health workers or social service workers and all the informal workers and workers from micro enterprises that are exposed to these climate changes. So I will speak about the six factors that have been determined and will be found in the report of the World Day of Occupational Health and Safety. We will focus on excessive heat, ultraviolet radiation, extreme climate events, air contamination, vector-borne diseases, and chemical products. Remember that this report has been structured according to these six factors, which were considered to be the most relevant ones to give some recommendations and figures of what's going on. I will begin with excessive heat. Here, I would like to mention that the report points out that every year more than 2,410,000,000 workers are exposed to excessive heat at work. Let's point out that these outdoor workers, and especially as I was mentioning, I mentioned the fishermen, but if we look at the agricultural sector, we can see that, that the different sectors have important relevances due to exposure to excessive heat. One of the cases we saw in one of the countries were greenhouses in very hot areas. The greenhouses, and because of the way they were built, lacked the appropriate conditions to receive ventilation, and there was more heat in this workplace. It also says that 22.85 million professional injuries are generated in the world of employment. 18,970 deaths related to work, and how over 2 million years of life would be adjusted by disability. Some risk factors would be, as I mentioned, those that work out there or those workers that work in places that are not well ventilated. And this has an impact on the health of some of the workers, such as insulation, skin diseases, cardiovascular diseases, mental health problems. Sometimes we do not consider that there are some economic drivers in some places, and the droughts cause the products to lose their quality, and sometimes they are lost. And for the workers, this is very important. If I don't have products to be sold to be able to have a livelihood, there will be stressful situations, anxiety, depression, and other factors that we can point out. So, one of the aspects I want to mention is the excessive heat and how environmental conditions demand a physical effort and will require appropriate work apparel to be able to face these excessive heat conditions. Not only protection, personal protection equipment, but also having the appropriate ventilation and different controls. A second factor that you will see here is the ultraviolet radiation. 1,600 million workers are exposed to this radiation, and more than 18,960 deaths related to work only due to skin cancer. So this exposure, I insist, one of the priorities of ILO in recent years, and especially in the work carried out in the region, in the Andean region, is the agricultural sector. The conditions in which these workers have to perform, they are exposed to high radiation conditions during many hours. If we look at the coffee sector, the workers collecting the coffee beans would be out there for many hours throughout the day, and their exposure was increasing because of this. There is something quite interesting about this. The workers know that they are exposing themselves to heat, but they do not perceive that this is dangerous to them and that this radiation can cause them health problems. So, all of these cases of burns, eye damage, weakened immunity, skin cancer are some of the aspects taking place. I cannot argue for myself, but they were telling us from the fishing sector. I think that this would be interesting. Start to conduct research to see what is happening with these health impacts and the damage caused to workers. And fishermen would tell to us that sun exposure and being out there at sea was affecting their sight. The reflection on the seawater and the salt were aspects that were causing them to lose their sight. So we would need to see if what is happening is a result of the sun rays reflection or the salt. So these are topics that should be researched in order to strengthen other research work and the different repercussions due to ultraviolet radiation. And it's clear for us that the reduction of the ozone layer is causing greater UV radiation on Earth. So this is a second factor I wanted to mention. The third one, a very important one, is one referred to extreme climate events. We're talking about cyclones, droughts, storms, rainfall. We have seen how these extreme climate events can have an impact. There could be a natural and technological threat with the resulting NATEC accidents. We see how these climate events can result in major accidents. In the report, you will be able to see different cases related to forest fires, floods, serious industrial accidents. Remember that the ILO has Agreement 174 and 170 on the last one about chemical aspects. And what do we see that 2,06 million deaths caused by climate risks. This estimation is from 1970 to 2019, where we see the repercussions in different workers, biological risk diseases, burns, chemical impact. There is a case that I know, I read about this case, how in Cuba, an accident due to a natural event, thunder struck. This was a major accident that resulted in more damage. So extreme climate events are affecting us. And how is this related to the workers' health and safety? I would like to tell you about what happens in Bogota, Colombia. Some months ago, there was a very, very strong storm with severe rainfall, which generated rivers of water. And these rivers in the higher parts of Bogota caused the life of security guards. They never thought how this climate event would result in a landslide that caused the disappearance of these two workers. There are ways to draw the relationships between these climate events. Let's talk about plans. How are we articulating the management system from the valuation risk matrix? How are we designing our plans to attend emergencies and business continuity? And how do we relate our capacity to face those floods or droughts in the case of tropical cyclones? So some regions have been affected because of this. We have a third important factor, the events, the climate events that are severe. Let's reflect on this and think about how we are addressing this from the point of view of health, of occupational health and safety, and how are we providing assistance to emergency situations. Also in the case of remote assistance, and think about we can give an appropriate answer when necessary. So the third factor was extreme climate events. Let's remember this factor. I don't know, Berta, if I'm going too fast. Is that okay for the interpreter? Can you speak a little bit slower? Thank you, Berta. So I will try to go slower for the interpreting. I'm sorry, but one becomes very passionate about these topics and we speak very fast. So let's consider that when we have these natural or climate events, there are disasters that not only generate emergencies for the workers, but also for all the population as a whole. There will be emotional situations, anxieties, stress, post-traumatic stress when these events take place. And we need to start thinking and reflecting on how we are going to address these extreme climate events. This is not something new. Everything we're talking about has been analyzed, but how do we match occupational safety and health to emergency cases, disaster response, and how we articulate the response in the case of companies, firefighters, civil defense, and the different entities that have to respond to these events. A fourth factor would be air pollution. Here, the report tells us about a greater risk of exposure for the 1,600 million of outdoor workers. 860,000 deaths are related to work a year. In the case of air pollution, look at this very significant figure, and we see how this air pollution factor implies several actors that are involved. We have the agricultural workers, but also those who work in transportation activities, those workers that are exposed to air pollution due to carbon dioxide. For instance, in the case of fires, the firefighters that are the responders to this emergency. This is a climate event that could be natural, but also caused by man. The workers that are responding to these emergencies, such as the firefighters, have a very significant exposure to smoke, which can impact their health with several conditions, lung cancer, strokes, respiratory diseases, cardiovascular diseases, and eye irritation. Recently, here in Bogota, Colombia, there were different fires in Bogota, where all the smoke that was coming out of these forest fires was affecting all the population. So we see how air pollution is another fundamental factor that we need to consider as a risk factor and how this is impacting on the workers. We have another relevant factor, number 5, the vector-borne diseases. Every year, more than 15,170 deaths related to work can be attributed to parasite and vector-borne diseases. Rains or storms can increase the vector population and also the survival and reproduction rate can be increased with a higher number of vectors that can increase the risk level. or that can cause these diseases to workers. In some places, the ecosystems and human systems end up having impacts such as droughts. So the report talks about this, how high, talks about the high risk workers, those who work outside, how these vector-borne diseases can have impacts on health, such as, for example, the Chagas disease, malaria, and the dengue as well, and other effects that result from vectors as a result of changes in climate conditions. Finally, we have a sixth factor that was highlighted in this report, which says that more than 873 million agricultural workers have a higher risk of exposure. We're talking about the agrochemicals, the herbicides, the pesticides. In many cases, we are seeing a more natural production, chemical free, with a more organic production. However, there are many workers that are still being exposed to these chemical products. They use these products to control plagues, and with the rainfall, there could be more significant plagues. If there are droughts, this could also be the case. These products, these chemical products, would be required to control the plagues. More than 300,000 deaths a year due to intoxication with pesticides. And we talk about cancer, cardiovascular diseases, reproductive conditions, pulmonary diseases. These are some of the conditions or impacts on health that could be the result of agrochemical products. I would like to mention that the ILO last year organized a free course on the management of agrochemical products with the Agricultural Training Center of Turin. This course is free. It is a 6-hour course, and there are no limitations for you to take this course. I will be sharing the information if this is relevant for you. So these are the 6 factors mentioned by the report under discussion. It tells us that we should not forget that climate change is a starting point for an impact on mental health. Topics such as labor insecurity due to climate change could be one of the causes. We see that some professions, as such, end up, we're talking about different situations of disasters, agriculture, infrastructure. There are higher risks in the case of mental health, and there could be situations such as post-traumatic stress, as I mentioned, depression or anxiety. Well, these mental effects can cause behavioral changes, sleep problems, concentration problems, and we have to remember that if there is no, if the concentration is affected, there will be a repercussion in the workers. So, protect workers in this changing environment. The report establishes certain strategies. The first one, let's remember that since 2022, there was a fifth principle to have a safe and safety employment environment. There are five principles. One is the elimination or eradication of child labor, the elimination or eradication of forced labor, everything that is related to collective bargaining and trade unions. And there is now a fifth principle to be able to have a safe and healthy employment environment. Let's remember that there are international labor standards or regulations and other instruments that provide guidance to protect the workers against the different dangers and risks at the workplace. I was mentioning Agreement 174, 170 in the case of chemical products. We have several agreements that can be related to this matter, and we also have technical guidelines. I wanted to mention the policy for a fair transition towards environmentally sustainable economies and societies of 2015. This is a very important triangle, the social, the environmental, and the economic part. Remember that there is a new ILO global strategy for 2024 to 2030 that highlights that climate change should be a priority in world and national policy agendas. Remember that the General Discussion Committee on a Fair Transition that took place in the International Work Conference of 2023 also stressed the urgent application of occupational safety and health measures for workers affected by climate risks. And also, the ILO has the Vision Fund Zero, which is supported by G7 countries, that develops different initiatives to reduce occupational accidents to zero based on supply chains. There are different initiatives that have been developed by the ILO with regard to the different factors, risk factors that I mentioned. Some of the agreements that are highlighted here, some sector ones. We were talking about the agricultural workers. We have Agreement 184 about employment or workplace health and safety for agricultural workers. We have Convention 115 about radiation. We have recommendations about housing. You will find Convention 181 in the case of major accidents. I also mentioned Convention 170 and Recommendation 77. You will find different work regulations and practice codes to face these climate changes that are related to the health and safety of workers. I would like to end up by talking about these different national responses in the report. The first one, be able to move forward in the revision of the regulatory and policy frameworks to see if it is necessary to make updates or to generate new laws in the case of occupational safety and health. With regard to the health and safety of workers and climate change, and how to articulate these important factors. Everything that is related to collective bargaining agreements, these agreements become a fundamental part inside companies. There should be a discussion on how we could leverage safety and health matters at the workplace, considering climate change. Remember that the different guidelines that exist already or the ones that need to be developed are important, such as the permissible limits of heat, how are chemical substances handled in different countries. The labeling, the harmonized labeling system has already been developed, and the different guidelines in the different countries also become a fundamental factor. Let's remember that we need to continue raising awareness, providing training, and as we said, in the case of occupational health and safety, we hope to have safe and healthy generations. We need to remember that we need to address the situations and see how this impacts on the environment, reduce the possibility of causing these weather or climate events, to stop increasing UV radiation or heat. And we need training and education and continue raising awareness. And I would like to wrap up my presentation by highlighting the importance of generating these relationships between public health and climate change, occupational safety, and health. I have been mentioning this since the pandemic, how public health became a fundamental factor. We see the different campaigns, for instance, in the case of skin cancer, but now as we relate this with the workers from the point of view of public health and climate change. So I would like to greet Maria del Carmen, Berta, and all those people that make these spaces possible. And I would like to thank God for letting me be here today. And that's all. Thank you, Snyder. It was an excellent presentation. It is a great motivation of the report to guarantee health and safety at the workplace in a changing environment. We have shared with all the people who have joined us today the report issued by the ILO, which reveals alarming new data on the impact of climate change of the safety and healthy of workers. In the last presentation, we saw the different factors affecting health from, for instance, the vector-borne diseases, the UV radiation, the excessive heat. This shows us the connection between climate change and environmental problems. That's why we always talk about a planet crisis, not only in the case of climate change, but also in the case of excessive contaminant production and waste, and all our efforts in terms of certification. And the concept of climate crisis and planet crisis is so important. I would like to mention that there are many people joining us today from different parts of the America. Also here we have a committee from the Orozconu who work in the case of disaster management and climate change since 2020. We were able to move forward with a project known as the Andean Climate Plan with different challenges that were mentioned. One of the challenges would be the intersector articulation to address this problem. So one of the first questions we received was, what are the possibilities that you see in terms of articulation with regard to the Andean Plan on climate change? I would also read two very interesting comments. The consequences are incredible. The consequences we are being exposed to. Let's hope that companies realize that the most important capital for progress is workers. There is also a comment with regard to heat related to climate change in occupational safety and health. It is important to look at the heat islands in urban areas, especially for field workers that work in immunization campaigns, because we usually associate that heat waves have a great impact affecting fishermen, agricultural workers, farmers, and construction workers. And now this question reminds us that the human resource should also be considered because it is being very much affected. Now I would like to give the floor to the next speaker.
Perdón. Bueno, muchas gracias, Berta. Entonces, como les
Berta,
contaba,
thank you. As I
ante
was
todo,
mentioning, first of all,
como se dieron cuenta, les decía
as
que tanto
you
la
may have
estrategia
realized, I was
del
saying that
trabajo del Comité
both the
2024-2030 como la
ILO's
estrategia del Fondo de Naciones Unidas se ha plasmado
2024-2030
y ha considerado como
strategy
una de las
in the
prioridades
case
también
of
atender los temas del cambio
occupational
climático.
health
Entonces,
and safety has
esta estrategia
established as a
se está
priority
considerando
to address
efectivamente
climate
para poder
change
desarrollar
impacts. So
diferentes
the strategies
iniciativas
here
en el mundo del trabajo
in
que
the ILO,
están
in
incluyendo
terms of
temas
different
relacionados
initiatives,
con
are
ese
including this
muy
very
valioso
important
puesto de
topic.
trabajo que
I
han desarrollado
believe
ustedes en
that
este plan,
all
con
of
este trabajo
this
conjunto de los
work
países andinos
that
y
you have
que
been
esto
carrying out
me
in the Andean
parecería
countries is
supremamente
very
vantajoso
important.
poder replicar lo que
I
ustedes ya construyeron, o sea,
think that it would
socializar
be
y
very
hacer
valuable to
mucho
replicate
más
what you have built,
esta información que
socialize
ya se encuentra trabajado, esto que ya es
what
un documento
has
público, ¿cierto? Y de cómo
already
podemos comenzar a
been
trasladarlo también a diferentes y hacerlo conocer más
generated as
fácilmente.
a
Cuenten con
public
nosotros
document.
para
So
poder hacerlo
please
más visible,
do not
¿cierto?
hesitate
Y
to
comenzar a articular algunas
ask for
iniciativas
help
estratégicas.
to
Yo
make
les cuento que
this
este
information
año vamos a comenzar a trabajar en
public.
Colombia, por ejemplo,
I was telling you that
temas
this
relacionados con
year
seguridad y salud en
we're
el
going to
trabajo,
start working in Colombia with
en el sector del
occupational
cáñamo.
health
Entonces vamos a
and
trabajar,
safety matters
uno de los
in the
sectores que se han
sugarcane sector.
priorizado para este año es la
This
producción de caña de azúcar,
sector
pero la
has
producción
been
de caña de
prioritized
azúcar
for
es
this year.
perdón, voy a decir esta
I'm
palabra,
talking
pero es
about
grandote,
I'm
¿cierto?
talking about
Tenemos
sugarcane
todos los
production,
azucareros, pero
which
por ejemplo
is
la
a
caña que
big
tenemos en
monster.
Colombia
We
se
have
llama la
all the
panela
sugarcane
y
plants, but
entonces
also we have
también
something
vamos a
known as
desarrollar
panela in
diferentes iniciativas
Colombia. So we will
en este
develop
nuevo
different
escenario para poder
initiatives
ir a trabajar
that
nuevamente en la ruralidad
will
y comenzar a abordar estos temas de
l-
seguridad y salud en el
take
trabajo.
us to rural
Más
areas
adelante
again,
podemos
working
profundizar en
on
eso. Y hay
climate
otras
change
iniciativas que se
and
están gestando a
occupational
nivel
safety and
decirles
health. And there
que
are other
están en
initiatives
inquietud todavía, no les puedo contar más por el
in the
momento,
works.
pero
I
hay
cannot
otras
tell
cosas que
you
se van a
more,
hacer en
but there
Perú,
are
otras cosas que se van a
other
hacer en
projects in
Ecuador también,
Peru,
para trabajar.
Ecuador,
Entonces,
in the rural
temas ahí.
regions.
Y como la
So
segunda pregunta, Berta, pues
with regard
mucha
to the
información
second
al
question,
respecto,
Berta,
no
I
hay
think that
demasiada
rather
ciencia.
than a question, I would
Las
say that
personas de la
it is a
economía, hay una
statement.
parte del informe
Health
que dice que
workers, and
las
there is a
personas de la
part in
salud
the report that
pública que
says
se
that
dedican
public
a
health
desarrollar ese
workers
trabajo en el
that
territorio,
engage in
también están
this type of
expuestas y por
work are
eso
also
resulta que todas
exposed.
esas trabajadoras y
So
esas
it
personas que
highlights
están
that all
con
these
exposición
workers that are being
al espacio
exposed
libre o en condiciones,
to
hay una colega, voy a
open
decir
air
su nombre,
spaces, I'm going
está
to
desarrollando un
mention
estudio muy
the work
interesante
of
y
one of
es
my colleagues
cómo
who
dentro
is
de los
working on a very
invernadero
interesting
se
study
está afectando a los trabajadores por temas de
about
calor.
the
Entonces
heat impact on greenhouse workers. This monitoring is taking place in Mexico, and I think that this is very important so that we are able to see what is happening to outdoor workers and greenhouse workers and see whether there is a relationship between the heat and the increase of risks. That would be another initiative to exchange good practices and experiences in the region. All the people here from health ministries and other organizations can be interested in this because the Andean Health Organization is promoting South South collaboration, the exchange of experiences. You can count on our organization and you can also count on the Climate Change Andean Committee. With regard to climate change mitigation, we need to transform our development models and our relationship with our planet, which was the topic of last week's webinar, the calling to take care of our planet to prevent these problems and achieve well-being. Dear Schneider, we know that you have to leave because you have another event organized by the ILO. Could you please give us a final message? Well, I think that the message is let's remember that the labor world and the world in general are related, and this climate change situation affects all the population. And if we're looking for common strategies for the ILO, the bipartite and tripartite dialogue is of the essence to develop sustainable actions for the world of employment. I would ask everyone to join efforts and remember that the social, labor, and environmental aspects are interrelated and that we need to make an effort between the different social actors. Thank you so much, Schneider. Thank you for this very interesting presentation. There are challenges for us to continue working with other ministries and sectors, and also to articulate our efforts with these initiatives regarding occupational health and safety and adaptation to climate change. Thank you. Thank you so much, and have a nice day. Next, I would like to extend a warm welcome to Dr. Maria Luisa Mariño. She's a sociologist, master of social policy and PhD in the same discipline. She works in the Social Development Division of the Economic Commission for Latin America and the Caribbean, ECLAC. She is a technical focal point on disability issues and is also in charge of the health area in the same division. Previously, she worked at ECLAC's subregional headquarters in Mexico on research on women's labor inclusion and social stratification in Central America and Mexico, as well as technical advisories on the 2030 Agenda for Sustainable Development. Before joining ECLAC, she was a researcher at Fundación Espacio Público and worked for the United Nations Development Program, UNDP in Chile. She also participates in the Andean Intersectoral Roundtable for Coordination Against Social Inequalities in Health of Oras Kanu. You have the floor. Maria Luisa, good morning. Thank you so much for the invitation, for being here. I would love to have a more active participation in the table. That would be the intention. I would like to greet Dr. Calle and also Dr. Malki. Thank you so much for the invitation to participate in this webinar. Greetings to Schneider Wataki, my colleague. His presentation was very interesting. It is incredible to see how a complex phenomenon could be analyzed from different perspectives. He has given us a glimpse of the future in terms of a climate change impact on the health of workers. The presentation, today's presentation, is focused on the social panorama of Latin America and the Caribbean published in 2023. The central topic is employment or labor inclusion and how it is a central point for inclusive social development. Can you confirm that you can see the screen? Yes. This presentation has been organized in 4 components. The first one, regional context. I will try to speak slower. This is an annual publication at ECLAC, and it considers a central topic. And it always gives us a glimpse of the regional situation in terms of poverty, inequality, and low job growth. After the regional context, we will talk about labor inclusion and why we say that labor inclusion is the backbone of inclusive social development. The third point deals with labor policies. We believe that they should be promoted by countries of the region and their relationship with social protection. And this is a cross-cutting issue with health because, as Dr. Calle said at the beginning, having or not having a job or the characteristics of our jobs is a social driver for health. And finally, the concluding remarks. So, with regard to the regional context, we see that in 2022, the region had regional poverty rates similar to pre-pandemic levels. The poverty rate was 1.2 percentage points lower than before the onset of the pandemic, while extreme poverty remained at levels similar to 2019. This is good news in terms of recovery of poverty levels prior to the pandemic, but not such good news with relationship to what is coming in the future, since the economic growth rates for the region will have an impact on the different policies to be able to overcome poverty, and extreme poverty will be low. The expected economic growth rate for 2023 is 1.7% and does not allow for seeing improvements in the poverty situations. What we see is that there are certain groups in the population that are subject to a greater impact in terms of vulnerability. We see children and adolescents. And this is, of course, a very preoccupying situation. We see the cumulative effect on the health of people and the comprehensive development. We also see that poverty is higher among women, and it is higher among those who live in rural areas compared with those urban population. And it is higher for the indigenous population. This also shows us that poverty is not equally distributed. There is an inequality in the case of poverty and health social drivers. Also, the inequality of income went down in 2022. below those recorded in 2019. However, there is it is a very high inequality level. In Latin America, we see an average income that is equal to 21 times the lowest level. This is a very important gap that results in inequality levels that are very high. We are one of the most unequal regions in the world. It is the most unequal one in terms of income, and this lack of equality translates into limitations for growth because inequality affects possibilities to access growth or to generate production and has a direct impact on the population's health. These variables shows us how, for instance, the creation of employment between or job creation between 2014 and 2023 is the lowest since the 50s. We have gone back significantly in this decade between 2014 and 2023. The growth rate of the number of people in employment will be 1.26% compared to 3.2% in the 80s. In 2020, we saw the first drop. We see the blue bar, the first fall. Job creation fell. It was generated by the pandemic, but it has a relevant impact on the employment rate at the regional level. And the importance of saying this is that inequality, poverty, and the unequal distribution of poverty, the lower growth rate are variables that are directly developed with the possibilities for social inclusion. Now we talk about social inclusion as an important point in inclusive employment development or inclusive social development. We see a diagram that shows the distribution of individuals according to their employment participation. We see that in 2022, there were over there were 502 million of peoples that had the age to work, and 314 million were part of the labor force. We're talking about 60% that is part of the employment force. And let's point out what we do. We analyze the conditions. We analyze the conditions of the 314 million people, the conditions in which they work, to say that the insertion in paid jobs is a fundamental aspect for employment inclusion, but it is not enough. It does not guarantee inclusion. Out of the 314 million of people working, 22 million are unemployed. So we have 292 million employed people. Out of this number of people, almost half have informal jobs. Approximately 20% are people who are employed but live in poverty conditions. It is not a tool to overcome poverty. What is related to the fact that 40% receive income that are lower than the minimum wages and that half of the economically active population does not contribute to pension systems. So this is to show you how when we talk about the percentage of people working or employment rates, it is very important to analyze and stop to think what are the conditions in which people are working in the market. So what we point out at ECLAC that it is important to go from employment insertion to employment inclusion, and in this way promote inclusive social development. So the diagram shows in a direct way that labor inclusion is distributed in two sections, job placement and work conditions. We could say that this is a simple scheme. However, we think that it is important to show it because what we emphasize many times is job placement. We're saying that this is not enough. It is necessary, but not enough. So that we can promote labor inclusion, it is fundamental to have a well paid job and with access to social protection. And in this connection, it is necessary to guarantee the right to work. Berta, you were reading the conditions and the characteristics of the right to work of the population, but also strategically because labor inclusion supports economic growth, productive development, and the reduction of inequalities. So, in this connection, betting on higher levels of labor inclusion will also contribute to other dimensions that bring us closer to sustainable and inclusive employment development. However, in the region, we see that factors such as social inequality and also the productive structure, we know that we have a very marked and diverse structure. This will condition the people's labor inclusion. I will show you some examples of how labor inclusion works. I will talk about labor insertion. We're talking about all the population that is looking for jobs. Many have difficulties to enter the employment market, and once they are there, they have difficulties to access decent employment conditions. So, in terms of gaps, what we see, I'm talking about gender gap, we see that there are inequalities between men and women in employment markets. The graph that we're showing is about the evolution between 2019 and 2023. The estimations in 2023 show a recovery, similar levels to pre-pandemic levels, but what this graph also shows is that women continue to have greater or higher unemployment rates. We are estimated that the rate will be similar to pre-pandemic levels. It is estimated that the average labor participation rate of men and women will be similar to pre-pandemic levels, 63% in 2023, and 63.3% in 2019. As we can see in the graph, this labor participation is unequal and continues to be unequal between men and women. And in the social panorama that I invite you to read, this is a very brief presentation showing some figures and examples. Because of time constraints, what we can see is that the lack of integral systems in Latin America and the Caribbean is one of the main obstacles to labor inclusion of women. And we're talking about labor insertion and labor inclusion. For instance, women that can work in full-time jobs to guarantee their well-being. This lack of support or the lack of schemes that allow for women to enter the employment market in equal conditions affects mostly poor women who have less possibilities of hiring private services that can open spaces for them in the employment market. The case of minimum wage is also an important part of promoting labor inclusion. We see that in 2022, 92 million people in employment in countries of the region had a wage below the official minimum wage. The analysis is based on each country's figure with regard to minimum wages, and we see that around before the pandemic, it was 32.6%. People earning wages below the minimum wage, and this rose to 36.8% in 2022. This situation affects mostly younger and older people who we know have more obstacles to enter the employment market with decent working conditions. And it also affects mostly in the case of paid domestic work. And this affects mostly women, as we see in the gender gap shown in the graph. This is also the case of informal workers who represent a significant percentage of employed people in the region. They have wages that account for a figure lower than the minimum wage. I also wanted to mention that in the case of paid work, we see this reflected in the report. Also, in the case of migrants, another aspect is related to the emergence of digital platforms. We did an analysis in the case of domestic services, those who need these services, but this also applies to the different uses of these digital platforms. In fact, this labor inclusion modality has several probabilities, schedule flexibility, or it gives more autonomy to the worker, electronic payments. There is a digital component. However, this digital transformation is not neutral, such as telemedicine, for instance. We're talking about a phenomenon that could generate opportunities. In this case, it could increase the number of employment positions, but it could also increase the gaps. We see the irregularity of working days that are not in compliance with national regulations. Also, the limitation in the case of Social Security, we see that platform workers do not have access to Social Security. In the case of
la necesidad de poder
pension system or access to health. And this makes us think that we need to strengthen regulations with regard to digital platforms to ensure decent work for those employed through these systems. Now, the case of informality, of course, here you see 49% out of the 12 countries in Latin America with available information, almost half the population has an informal job. Informality is marked by inequality in the following terms. It is higher in the rural areas, in the case of younger and older people. And also there are social and economic and ethnic inequalities. Informal workers have 4 times more possibilities than the formally employed to earn an average wage. But also, we would like to point out here the importance that this could have on health. At ECLAC, we have carried out analysis, for example, before the pandemic, in those countries with higher informal employment levels, there are higher death rates. So this shows us that the quality of work is a social driver for health that is cumulative on the population's health over time. So the informal workers have less access to social protection and also are greatly affected in terms of health. As our colleague from the ILO was saying, we conducted an analysis at a household level among 11 countries in Latin America. There is at least one member of the family that has an informal job. I would like to highlight that 54.4% of households in these countries are formed by informal jobs. We're saying that everybody in this household has an informal job. This has an impact on the person and in the family structure. 21.7 million people that include women, children, and older people. This is important because the family group is unprotected in the case of health situations and also in the case of pensions. And looking at this panorama, what are the inequalities that we see in our region? So it would be important to move through higher labor inclusion levels through labor policies and their relationship with social protection. What we're saying is that social inclusion policies are considered a main action, but also inequalities in terms of employment and multidimensional inequality, which is a feature of Latin America and the Caribbean. So in order to be able to move towards inclusive social development, we need to implement a development strategy that includes social inclusion at its center and also health. Both need to go hand in hand and strengthen development strategies. In this scheme, we see in the middle box, we see the need to articulate active policies such as training, the incentive, the different incentives such as the passive policies in terms of unemployment. We need to articulate both types of policies, not only articulate them, but also expand them in terms of funds. These need to go hand in hand with the strengthening of labor stability in the case of minimum wages and also in the case of the working day, and articulate this with the different social protection systems and also with the development, the productive development policies that have an impact on the inclusion of people. Here, I would like to show you the annual expenditure in terms of policies. We compared 15 countries in Latin America and 25 countries in Europe. In 2020, there was a significant increase in public expenditure. As a result of the increase, there was an increase in passive policies, unemployment insurance, and the protection to unemployed people. And this was largely what was invested significantly during the pandemic as a result of the social and health and economic crisis that resulted from the pandemic. In 2022, we go back to 0.42 of the GDP oriented to these public policies and in a scheme that is similar to that of pre-pandemic levels. When we compare this to European countries, we see that Latin America invests very little in employment policies. We see 0.4% in Latin America in comparison to 1.9% in Europe. What we see is the relevance of passive policies in Europe. If we see the green box, I apologize because I think there is an inconsistency there. I don't remember what the green box meant, which is present in Europe but not in Latin America. What we see is that Europe maintains a high proportionality with regard to passive policies vis-a-vis active policies, which is contrary to what we see in Latin America. And here, what we point out is that active policies allow to focus mainly on those population groups that have greater barriers to employment inclusion, those with the greater difficulties, those who have problems to access decent working conditions. So what we say here is the need to implement these policies to subsidize the entry of these groups and improve their employment conditions. Of course, this goes hand in hand with labor inclusion policies. Labor inclusion policies contribute to the sustainability of social protection systems. And at the same time, social protection policies contribute to labor inclusion in various ways. We see different ways through the reduction of informality and the access of social protection, the expansion of contributory coverage among self-employed workers, labor inclusion policies for the most vulnerable population groups, strengthening of the regulation and labor institutions, and other elements that will also allow to strengthen the employment inclusion of people and strengthen social protection systems and of course one of these is the access gaps to health care systems. I don't know if I'm okay with time. Berta? No, no problem. I have two more slides, so please pay attention. As final remarks, I would like to say that or stress that the region, after the 3 or 4 years of the social and health crisis resulting from the pandemic, there is a recovery in social indicators, but there are still very deep inequalities in the case of inclusive social development. There is a favorable tendency in some cases as compared to what happened during the crisis, and this is taking place in a region with low growth, and we need to address the different challenges here. The low growth makes employment inclusion difficult, and labor inclusion is an element that we have been analyzing, and everybody here knows that it is a fundamental issue to reduce inequality and job informality. I would also like to stress that this is very important in terms of increasing economic growth. And in this webinar, we're not talking about work just like that. We're talking about decent work, which will allow us to reach a sustainable and inclusive employment. And this element is a central theme of the ECOSOC and the Future Summit. And we also think that it will be mentioned in the World Social Summit next year. And here to wrap up, I think I am repeating myself. There is a need to move from insertion to inclusion with a view to prioritize groups that have more obstacles to access jobs or work in an inclusive situation. We prioritize these groups, but this approach should include everybody in the employment market, strengthening the link between labor inclusion and social protection. Of course, with an approach to the expansion of training offers, which we know restricts labor inclusion, paying attention to an equal distribution of domestic work. And also we will need here the design and expansion of active policies in the employment market hand in hand with a strengthening of the institutionality. All the policies that are developed and implemented need to secure the well-being of future generations without this undermining present generations. And this, of course, will require to increase expenditure in on labor policies, which on average allocate 0.42% of GDP to this area, which is insufficient to address this problem. It is important to guarantee the right to work of a population to move forward with the sustainable and inclusive social development. Thank you so much for your attention. Thank you, dear Luisa. It was an excellent presentation, which gave us a social overview of Latin America with emphasis on social inclusion. We have shared the link so that the participants can read the report. We have received many comments on their interest of continue reading. We heard about topics that we addressed in the roundtable with regard to different cases of inequality, which shows us the different problems such as poverty that affect children, adolescents, and women, and the great challenge of labor insertion, moving forward to decent working conditions and the emphasis placed on productive work that is well remunerated, having access to social protection. The ideas shared have been very interesting. I would like to remind the participants that in the website of Orascona, you can find the presentation, and the speaker talked about the different policies centered on labor inclusion, and this is related to social protection. And without this, we will not be able to move forward with a sustainable and inclusive social development. We have received many many words, comments, questions. There are very interesting and challenging comments. We have been talking about decent working conditions, but there is no work for people with disabilities in the region. The international agreement for people with disabilities is not being complied with. There were comments about these problems. Employment for people with disabilities. There is also a reflection on the care that we have to apply when using digital platforms because they may reproduce stereotypes in terms of gender or disability. There were also reflections about remote work. And let's say that the arguments in the different countries in terms of moving forward to ensuring the right to health. But in the case of remote work, there are different biases that are being exposed. There are three questions. Could you please give us your views on those three questions, and then I will read the other ones. Berta, thank you. With regard to people with disabilities, there is a section in the social panorama that addresses this topic, different sectors of population and people with disabilities. There are many debts in the region to guarantee the right to work of people with disabilities. Also other rights, but particularly the right to work. This goes hand in hand with the difficulties of people with disabilities with regard to education, the pending obligations in terms of inclusive education, the number of years of people with disabilities is lower than people with no disabilities. And there are different elements where we can move forward, such as accessibility to workplaces, raising awareness with regard to the obstacles faced by people with disabilities. All of this, of course, is related to institutionality and legislation, but in practice, we know that there are many people with disabilities that are not able to access a job with decent working conditions. And this was one of the elements that we think could be strengthened in the case of employment institutionality and also policies aimed at training in different areas. 3 years ago, we had a project regarding labor inclusion of young people with disabilities, and one of the countries with which we were working, we helped them with developing further training programs they already had, but programs that were not accessible to people with disabilities. These are like small actions that could contribute or facilitate the labor inclusion of people with disabilities. With regard to digital platforms and the risks, we say that they are not neutral. It is a space that can reproduce what we already witness outside the digital space. It is important to count on a legislation of these digital platforms.
Ocurrir, pero la
It
práctica
is
sí
a
ocurre
space
en un
where
espejo, pero
discrimination
realmente podrían
could
no
not
ocurrir siendo
emerge.
un espacio virtual. Pero por
They
lo tanto,
shouldn't,
y esto es
there
importante
shouldn't be
porque
any
no
discrimination
solo
since it is a
representar
digital
plataformas
space.
digitales, sino que como mencionaba en la presentación,
As I was mentioning the presentation, digital transformation requires guidance and legislation and policies so that it is a tool that benefits social and labor inclusion. With regard to the remote work, I don't think the question was very clear. I didn't understand that question well. I apologize. It goes along the lines of reflections of digital tools. They are saying with remote work, we thought that it was guaranteeing some key elements of social inclusion, such as flexibility, but also it is concealing other inequalities. Of course, when we think about gender inequalities, for example, women who works from home also results in the situation that women have to work in non-remunerated tasks at home in addition to her regular work. But when we say it's flexible, we have more freedom in terms of schedule. But this, for instance, goes hand in hand with the situation where women have to take care of others at home. And it's not related to how remote working is designed. So there are challenges in this area that need to be tackled. We have also been asked for a comment on labor harassment or workplace harassment. I don't know if this is included in the report. When we talk about insertion, it is also necessary to consider how to tackle situations of harassment and sexual harassment. And the other comment was where where can we report working conditions that are not consistent with the right to work in decent conditions. Thank you, Berta. Of course, the case of workplace and sexual harassment is a very important topic that can be seen more and more. It is not an aspect included in this edition of the social program. There is a very significant challenge in terms of figures. We know that it has to do with the protection of whistleblowers and the obstacles experienced by victims to report these events. And with regard to the to reporting working conditions that are not compliant with employment legislation, we have the employment bureaus, and I will be speaking as an expert. I know that in Chile, there is the Dirección del Trabajo or the Employment Bureau responsible for supervising compliance with employment regulations. I know we have similar entities in different countries. We are in the same region, but we use different labels. But these are spaces where these reports can be made at a government or state level with the presence of an external inspector to investigate these situations. We would like to thank you for the very interesting reports of CEPAL, and I would like you to give us a final message. Of course, I would say that as a final message, thinking about the current difficulty. We are in a challenging moment, not only because of the economic or weather or social conditions mentioned by the other speaker. They have an impact on health. Without health, there are no employment possibilities, as it was proven during the pandemic. We need to strengthen the efforts towards inclusive and sustainable social development, and education and health are very important. Labor inclusion has benefits and positive results that will be a contribution to reach this development towards multidimensional development, not only in terms of inclusion, but also at a macro level. Thank you so much. And I would like to stress it is a social driver. Work and the quality of work. We had a workshop on Monday, Tuesday, and Wednesday to analyze the reports on monitoring inequalities, and we should point out the commitment with monitoring these drivers. Thank you so much. We would like to thank all the people that have joined us today from the Ministries of Health, academia, various entities and social organizations of Argentina, Belize, Bolivia, Chile, Colombia, Cuba, Ecuador, Spain, Guatemala, England, Mexico, Nicaragua, Paraguay, Peru, Uruguay, Venezuela, and many other countries. We have received many greetings. Thank you very much. We would like to thank you for the questions made. We appreciate your participation and interest. We would like to thank all the participants, the ORAS KANU team, those participating in this activity, and thank you to the commitment to the Andean and Latin American integration. We would like to reiterate our thanks to Snyder and Luisa for their presentations on topics highlighting key ideas. I would now like to give the floor to Dr. Maria del Carmen Calle, Executive Secretary, to close this webinar on behalf of the Andean Health Organization, Hipólito Unanue Agreement. Go ahead, dear Dr. Calle. Well, thank you so much. First of all, I would like to thank the two speakers, Snyder Wataki and Maria Luisa Mariño, because they have made excellent presentation. It has been an excellent webinar. I'm very honest when I speak. When I say excellent, it's because I really believe it was a very good webinar. What do we have to think about this? One of the topics that we always reiterate, sometimes excessively, that it is mandatory to have decent work. There is no discussion about that. When we talk about a decent work, we're talking about different aspects. We're talking about fair employment conditions, safe working conditions, adequate salaries, which allow for a decent livelihood, social protection, equality of opportunities, the eradication of discrimination, and the respect of employment and human rights. But we are also talking about having a safe space. We are talking about what Snyder mentioned, the climate change aspect and what Maria Luisa said with regard to the social aspect. I would like to say that we cannot turn our backs on reality. We are going through a challenging time. I always say that when we're older, not you, but me, we will remember the pandemic as before and after. It has been an event that has marked humanity and has left us with more inequalities. And something that we always stress is that work is a social driver of health. And as we say, health is of the essence for development. Labor inclusion is essential for an inclusive social development. So having the figures is useful, but as the saying goes, if there is no action, we have nothing. And I always say we cannot treat equally those who are different. So when we have territorial figures, and that is why we're working in inequalities, where do we need to provide more support? Or as we say in the national agreement among the different governments in Peru, we already know where the girls that became mothers between the age of 12 and 14, we know which children were born with low weights. We know what are the climate threats they are facing. We already know, but what are we going to do about that? And I think that employment is part of all of this. And I'd like to say that responsibilities are not only at the national level, they have different levels at the local level, at the provinces level. For instance, the local governments that are closer to people, they should have their own share of concern. And one thing that our 6 countries have is a large amount of regulations. The idea here is to materialize these regulations and consider that when we talk about employment, we're also talking about intersectionality. It is not the same when we say, I work here, you work there, I work in a rural area. The fact that I do not have access to health, and as opposed to your situation where you have other possibilities and advantages. It is important to measure this in terms of social inclusion. It is very, very challenging and complex. This was an excellent webinar. You have given us recent data. We need to move forward. We have worked a lot in this aspect. We make available to you the Andean Plan for Climate Change and Health. We want to share this very good document with reflections on inequalities.
La idea de estos webinars.
We share this with you because that is the idea of these webinars. We learn, you learn, and we exchange new ideas, strategies to make this world a better world. Thank you so much for your presence. I would like to invite you on Tuesday. We have the webinars that we started with the Latin American Pediatrician Society. On Tuesday, we will talk about a very important issue. And we need to do what we say. We need to be consistent. So on Tuesday at 5 p.m., we have a webinar with the Latin American Pediatrician Society, which is the intercultural approach in the management of health systems and services, the experience of La Seremi in the region of the Araucanía region in Chile. We're going to present this. And on Thursday, we will have the meetings, the monthly meetings
en la cual
with
presentar
the British Embassy, where we present the British perspective. We talked about services, digital health, and this Thursday we will talk about mental health,
es una emergencia mundial,
which
especialmente en nuestra
is
niños
a world emergency in the case of our children and adolescents. Thank you so much. It was an excellent webinar. See you on Tuesday and Thursday. Thank you, Berta. Thank you, Maria Luisa.